fi meet. Can't afford to let Guyana stay in poverty. APN, you come for change with destiny.
Put your hands up, put your hands in the air. If you're ready for change, put your hands in the air. If you're ready to vote, put your hands in the air. The APNU is here.
We come to bring a better education for the children them. Better but the promises they making them, they keeping them. Them can't take regimes for betterment and them be killing them. Can't real with people when them really should be building them.
Put your hands up, put your hands in the air. If you're ready for change, put your hands in the air. If you're ready to vote, put your hands in the air. The APNU is here. I wanna be able to sleep safe at night. Drop the crime rate from that ridiculous height. We need a government to make our future very bright. Bridger, come turn on the light.
Put your hands up,
put your hands in the air.
If you're ready for change,
put your hands in the air.
If you're ready to vote,
put your hands in the air. The APNU is here. Let me hear you shout.
Go Granger, 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 go Granger.
Guyana's future in your hands. Vote APNU. Now, live from the capital city, Georgetown. Political, legislative, economics, and current affairs. The People's National Congress Reform, PNCR, presents Nation Watch.
Well, it's all about PNCR for national unity and good governance. Yeah.
It's you
and I.
It's you and I.
I say you and I.
It's you and I.
It's you and I. T-Y, can I? It's you and I. That's the only thing we gonna try. I say you and I. T-Y.
We need someone to take us to the stars, lead us to a place nice and warm, yeah. Who's gonna clean up all this mess? 19 years of endless stress.
Granger, take over this government.
You can hear it east, north, south, and west. People calling for the best.
Granger, we want you as president.
Mr. Granger is the man to lead this nation, to bring a better future for this generation, for build better schools, better education, for bring back the reputation. Now we want a government that is trustworthy, provide employment and maintain security. Whether you're black, Indian, Amerindian, Chinese, a good life for all you Guyanese. We fed up of all the PPP.
Vote APNU.
Granger will succeed. 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 Granger will succeed.
A pleasant good day. It's Sunday, the 14th day of September in the year 2014. This is your live edition of Nation Watch Today. My name is Christopher Jones, thanking you for joining us on today's program. On today's program, we want to focus exclusively on the health sector in Guyana. And of course, in studio with me are two competent persons representing the Partnership for National Unity who can speak on the subject. To my immediate left is Member of Parliament representing the APNU, Dr. Karen Cummins, and to her left is Dr. George Norton, who is also the Vice Chairman of the People's National Congress Reform. And of course, the topic we want to focus on, as I mentioned before, is the health sector in Guyana, or the lack thereof, a proper health sector. Dr. Cummins and Dr. Norton, I would want to invite you now for some brief comments, and then we'll get exclusively into the program. What is happening in Guyana's health sector at present?
Okay, good day everyone, and thank you for having me, Chris. As you know, the definition of health is the not only the absence of disease, but the total well-being of your physical, your mental, and even your social. And it seems as though for in Guyana, having a good life, a good health life, is becoming elusive. We're having a lot of maternal deaths, we're having neonatal deaths, we're having an emerging disease of chikungunya, we're seeing a rise of the non-communicable diseases on the rise. So we have some problems here.
Definitely. Dr. Norton?
Well, good evening, good day to everybody. I'm glad that mention was made to the death rate of neonatal children or babies, neonates, and maternal deaths, as well as the chikungunya. But only recently also making the headlines is the suicide rate that Guyana has now becoming notorious for. And this is alarming because we know, of course, I would hope to develop this later down in the talk, but the main cause of suicide is depression. And the big question is, why are our productive sector of our society becoming depressed? And as it was clearly pointed out in some studies done, it is related to the economic situation of the country.
Very well, very well. All right, but I want to focus now on the chikungunya that is now definitely here, that has definitely affected thousands of Guyanese people. In early May, Guyana received its report about the first cases of chikungunya coming out from the Berbice quarantine area, of which a 3-year-old and a 50-year-old person was infected. It then moved to Region 5 with about 3 persons being affected, and then you had one reported case here in the West Rumville, Georgetown area. Ever since then, it's now about 2 months, we've heard no pronouncement, no report, no updates from the minister nor the Ministry of Health as it relates to chikungunya. Thousands of persons have been infected with chikungunya-like symptoms, and then later they're confirmed that they were indeed infected by. Is this a clear case that the ministry and the Minister of Health deliberately black out, so to speak, the information to the Guyanese people about chikungunya? Or is it not chikungunya, but it's just a case of persons getting fever and similar symptoms like chikungunya?
I think maybe the ministry at some point in time, it was in denial. They were in denial. But now the record has shown that we do have it here.
Yeah.
Prevalence in my clinic, if I see 10 patients, 6 out of the 10 come down with chikungunya. And so we definitely have to address it. No sense, we just have realize that we have it here and see what we can do about it, rather than just going in denial and say we don't have it.
That's right. Because
Yeah.
we've even seen a report from the Campbellville Health Center, for example. I mean, you just mentioned your health center. Campbellville Health Center reported about 60 cases, 60 persons daily being infected with chikungunya. And this takes me back to the issue of gastroenteritis. That was a case in the hinterland region. And then similarly, we saw a blackout from the ministry, no pronouncement, and several persons have died from it. Minister of Health, in terms of educating Guyanese people about chikungunya, how to prevent it and so forth. In your analysis, was sufficient done in this regard?
No, I think I've seen a few articles in the papers now. I wonder, I have reasons to suspect they're a little too late. But nevertheless, we still have to educate our patients and our populace about the disease, which will be here for some time because of travel and because of our sanitary conditions. As you know, chikungunya, the name of itself comes from Makunde, a tribe, an ethnic tribe in Tanzania. I think it was the southeast Tanzania, and in northern Mozambique. Since in the 50s it was in Africa, and then it moved to Asia and India, and then I think around 2013 it came in the Americas and more specifically the Caribbean. And now about May, July, as you rightly said, we have it in Guyana here. It's a viral disease transmitted by the mosquito, the Aedes species, Allopictus, which is the same that transmits dengue. The incubation period, meaning that time that a person is it infects an infected mosquito bites a person to the symptoms, the incubation period is about 1 to 12 days,
That's
but
right.
the average, the common average, is about 3 to 7 days. As you rightly said, the symptoms are high fever of 40 degrees Celsius or about 104 degrees Fahrenheit. Myalgia, muscle pain, you have arthralgia, you're swelling of the joints, you have the joints, the distal parts of your body, the limbs. So you have the ankle joints, the knee joints, the fingers, the wrist, coming down. One of my patients even said all the way the hip joint as well,
right, that's
so
right.
it's pain all over. They can't walk and so forth, and they're having this, some of them, if you're a little light in complexion, you have this maculopapular rash.
That's right.
In some cases, you may lose a little of your taste buds, you may lose a lot of taste. But that's it. We have no treatment for it. It's a virus. We have no vaccines as such. So basically, we try to treat the symptoms. The fever, the pain. But those in radio land out there, television land, you must know that it's a daytime mosquito. It's not a nighttime mosquito.
I see.
It's a
I
daytime
see.
mosquito. And someone says it's like sunrise and sunset, to guide you there. And so we have to be very careful of how we dress. Long sleeve, or hygiene. If you have your homes, if you can put mesh or some
Yeah,
in
no.
front of the door, and take care of yourself, as it were.
I want to emphasize now on the authorities, the Ministry of Health, not educating the people about it, because just in your remarks there just now, I and I'm sure the viewers out there as well, they had no idea that this is a daylight mosquito. You said
Yeah, daytime.
daytime
Yeah,
mosquito.
Yeah.
So I mean, because we would put the mechanism, the preventative mechanism in place at night.
Yeah.
You pull down the netting, you spray the mosquito repellent sprays or whatever the case be, but not knowing that this is during the day.
Yeah, they bite you.
No, Dr. Dr. Narton, you want to come in here?
Yes. No, Chris. If it walks like a duck and it quacks like a duck,
Mhm.
it's a duck.
It's a- That's
Okay.
right. That's
And
right.
the reality is, we can do the test for dengue. We had dengue in our society for the longest while. But what is happening now never happened before.
That's right.
I have seen strong adults, who are bedridden because of this virus that is now taking place. The pains in their joints and the high fever. I only shudder to think how children react, because if adults are reacting that way, and while I agree, or that somehow we got the impression from the Ministry of Health that this chikungunya is not a daunting situation, yes, we've got to be careful.
That's right.
We are not satisfied with the fact that you claim that you're working on it and have it under control quietly because you don't want to turn away tourists
That's right.
and that you don't want to turn away investors. What nonsense is that? Are the tourists and the investors more important than the people in your own country? We want to see posters out there, like we've been seeing posters about TB and about HIV and about all it. Like we are accustomed to seeing posters.
That's right.
It's only recently I see for the first time, after so many weeks, a poster on this chikungunya. It is a serious situation. Now, we can't say whether or not somebody died from chikungunya. But we're saying that if you have a sickness, if your immune system is not at its best, or if, for instance, a child for some other reason has diarrhea, but should come down with chikungunya, they will die.
That's right.
They will die. It might not be from pure chikungunya, but chikungunya will contribute to their death. And so we can't rule out the fact that somebody claimed that a baby died from Bartica because of chikungunya, or another person died elsewhere because of chikungunya. But the situation is serious.
That's right.
And I don't agree that information should be withheld from the public.
That's right.
And it was only in yesterday's papers we see one of the directors of the Caribbean Public Health Authorities informing that the population should be brought up to date, they should be fully informed and educated about the situation.
That's right.
So we are not contented that 81 cases were tested positive. We know from that 6-day a day at Campbellville Health Center alone,
That's right.
much less all of the country, that we've probably run into thousands already.
That's right.
Okay, so to only have 81 tested positive is not saying anything to us. We have got to do much more, and we feel that the Ministry of Health is deliberately neglectful and careless, and they're dragging their feet on this issue. we know what is to be done. If we have the equipment as they claim, if we have the local as they claim to do the testing, then we must get the people trained to test them.
But in that remark right there, the question now comes to bear. We were told that tests are being done in Trinidad. Samples are being sent to Trinidad. Is it a case that Guyana doesn't have the equipment, can't afford the equipment, doesn't have the personnel here to man those equipment, or is it that the Parliament has not allocated funding for such?
Now, the government is responsible and it would be held accountable for finding the funds.
That's right.
Okay, for getting persons trained in a crisis situation that we have. We have the equipment. We have the local, as I said. We don't have the personnel. But in the meantime, what is going to happen? Even if, and this was said a long time ago, I'm not so certain that those 2 or 3 persons were identified and has left this country as yet. The public wants to know. We want to see that you care for us. We want to see that you're spending taxpayers' money in our interest. So let us know who you identified and when they have left this country or when they're leaving, because it's too late already.
That's right.
Okay?
That's right.
And in the meantime, get somebody who's qualified from from Trinidad itself to come and work here. We don't want to see all the praises being given by visiting health authorities or PAHO, WHO, and that everything is bright and rosy in Guyana when our children are coming down with chikungunya and we have no means of testing to know whether it is chikungunya or dengue. That is definitely irresponsible on the part of the ministry.
I recall that when this disease had first come to bear, we had taken out samples, and we said they had some forms you had to fill up, and it was still gone to Trinidad. But then, lo and behold, because of the burden of the disease, they're just trying to do the vulnerable. So they're looking at the extremes.
Okay.
The very small children, or maybe the babies and the elderly,
Yeah.
maybe with comorbidities. So it's a sad story, as I echo the sentiments of Dr.
Dr. Norton?
Norton, that definitely we have a big reference lab. And I mean, one would have expected that they would have personnel rather than having as white elephant
That's right.
come here and train the personnel. So we, like a snowball effect, and they will
That's
then
right.
train.
That's right. Because, two things. Rightfully, as Dr. Norton mentioned, a few months ago, indeed, the Minister of Health, Dr. Barry Ramsrand, said that they don't want to scare off tourists. And sometime thereafter, we got similar, like what we had in the cases of gastroenteritis, a blackout. You heard nothing more about chikungunya. Meanwhile, thousands of Guyanese have been infected with the disease. It brings the whole question into bear in terms of trust. The Guyanese, the citizen as a whole, trusting the authorities with their very lives. I want to bring in this question now. Noting what we had as it relates to gastroenteritis, in which the Partnership for National Unity conducted its investigation and found that just over 10 persons had actually died, the largest number of those being young people, children. We saw Majority Leader David Granger bring in a motion to the National Assembly to investigate the cases of gastroenteritis. Now we have the case of chikungunya. Minister of Health said he doesn't want to scare the tourists off. We had a blackout. We have not been told or updated in terms of how many persons have now been infected, but you have thousands of persons throughout Guyana who reported symptoms like chikungunya. Out there's presently Ebola. Now, I want to say this first, God forbid that Ebola comes to Guyana, to the shores of Guyana. How could the Guyanese people trust the health authorities, the Minister of Health, to provide them with information, accurate, updated information, in terms of if such a case of Ebola reaches Guyana shores? How confident are you that the Guyanese people can relax and the authorities will take care of their interests?
A scripture in the Bible comes to my mind. If you can't run with the footmen, how are you going to run with the horsemen? And if you can't contain gastroenteritis, people shouldn't be dying in this day and age of gastro. We have different tools. We have the IMCI, the Integrated Management of Childhood Illness. You have IEC materials. Persons were trained. I myself did the training and was trainer of trainer. So persons are well aware of how to handle gastro, and yet, I can understand how people are at this day and age dying of pneumonias and gastroenteritis. Now chikungunya, as you rightly said, we seem not to have it under control, and so woe to God that we have Ebola here. I mean, 750,000 people will be wiped out.
Exactly. Dr. Norton?
The other thing about Ebola, all we've seen from Ebola is, what you see from the foreign television station. We need at least, once again, public posters, public lectures, and some form of idea of what this government plans to do, rather than probably hiding it like they've been doing. Ebola. It's in America. I think there are 8 cases right now, and spread not in only one state, in the United States of America. If it reached there, my brother, the chances of it getting to Guyana.
Even greater.
And we certainly will lose that battle, because if we can't handle, as Dr. Cummins said, the chikungunya, forget about the Ebola.
Mercy.
Another thing too, we have in our country, apart from tourists, we also have offshore medical schools and these institutions. And we do have like persons coming from Africa and so forth. I don't know if anybody screens them. What's the procedure when they come in here at the port? I don't know what's happening there, because you have people from Africa, and we know that this Ebola is in Sudan and Kenya and those places. So when folks come into our medical schools here, do we have any way and system of tracing and that kind of contact tracing or whatever? I don't know.
And especially the question if that mechanism has already been put in place at our ports of entry.
I don't know. Do we have a disaster? I mean, we're supposed to have a disaster risk management and disaster preparedness plan, but I don't know if it's just on paper.
Very, very frightening indeed. And in fact, I mean, again, emphasis on the fact that the ministry deliberately deceived the Guyanese people as it relates to the cases of chikungunya. And as such, thousands of Guyanese are presently still suffering from this disease. I want to focus now on Guyana's premier health institute, which is the Georgetown Public Hospital. We saw recently in the newspapers a young mother going there to deliver her baby and died in childbirth, as well as the infant, the unborn child. This is it's not new to the Georgetown Public Hospital. But Dr. Norton, the Partnership for National Unity just last weekend conducted its walkabout exercise in the Lane Avenue community. And of course, there you yourself met family members of a young woman who went to the Georgetown Hospital to deliver her baby, and she died. We learned just Friday from former Commissioner of Police Winston Felix that I think about four persons have been made contact with him reference to their babies that had died at the Georgetown Public Hospital. This is within a period of about 2 or 3 weeks. These cases, sir, is most frightening for any young couple, particularly a mother or a young woman who's about to become a mother, going to the Georgetown Public Hospital to deliver a baby. And this is, sir, Guyana's premier health institute.
Chris, it is frightening. Not only is it frightening, but nothing is being done to reassure the family, because a pregnant mother has got so much persons in her life closely attached to her. You've got the whole family tree.
That's right.
Is looking at that baby and expecting the mother to return with that baby in her hands. We have a situation now where your chances of the mother coming back alive, of the child coming home, is being reduced. No, I don't want to frighten the public out there. I don't want to do that. I don't want to raise alarm. But if you're going to leave your work in the United States of America to come back to Guyana because your sister baby died at the Georgetown Hospital, and in the process of getting the papers organized and so on, the clerk who's dealing with you suddenly exclaimed, "Oh God, 5 babies died last night."
Mercy.
you know. Now, I'm saying this to you because it actually happened. This was related to us. When investigation was done, the facts are that in the month of July alone, 30 neonates died at the Georgetown Hospital. 30.
Mercy.
And if you think that in July was a bad month, think about August. August is 45. 45 babies. The neonates
At the Georgetown
at the
Public
Georgetown
Hospital.
alone.
Alone.
And August, September, let's talk. The 1st of September to the 12th, not even half the month. 15 has gone already. 15 has gone already. The last, of course, are the most dramatic, which affect all of us, because APNU is out here in the public not to represent only its constituency.
That's right.
It's a national unity, a partnership for national unity, and that unity means every Guyanese. So it hurt us when the Rodney mother couldn't go home with her baby, and it will hurt us like Evita Singh last week Saturday couldn't go home with her baby because both mother and the baby died at the Georgetown Public Hospital for whatever reason. That is a violation of the mother's right to life in this country, and it is not getting better. Since in 2010, in 2011, you know, we've got what you refer to as this Millennium
Development goals.
Development Goals. We certainly are not getting any better. We're not getting any better. Okay, things are not happening the way it should be. When you visit the hospital, the same. Your shortage of personnel, shortage of personnel at the hospital. A situation was related to me by one of the doctors who worked there, and this is not hearsay. In a ward with 46 mothers and 41 babies who would be receiving intravenous, you had 3 nurses working. 3 nurses working. 46 mothers took 41 baby in one ward, and 3 nurses working. That is coordinated disaster. In the situation with Evita Singh, and I can't stop repeating her name, what has happened? It was she had to wait on to do a cesarean section, or she couldn't do a cesarean section in time to save her life and the baby's life, because we have one operating theater in the maternal section with one anesthetic machine for the longest while, now that we have it, or we don't have porters there on standby to remove her from that ward to the main operating theater.
Mercy.
And she died. She died.
Mercy.
That is the situation that exists. But we can correct the situation. And what is the response we're getting from the minister? He's more immediately what he said to the newspaper. I sent my CMO, that's the Chief Medical Officer, and the Chief Executive Officer of the Georgetown Public Hospital to ascertain what took place to tell me. And I have launched an investigation. How many investigations he have launched? How many maternal deaths we must have before he can get it right? You know, and rather than carrying on with with all the verbiage on the television about getting it right, you know, this is the person that we have running our Ministry of Health. Mr. Greenwich called upon him to resign because of the specialty hospital and Syringa Corporation. I'm saying he should go before then.
Very well.
Okay?
Very
Because fortunately, the Syringa Corporation didn't, we lost money. We didn't lose life. But we're losing life. We're losing life. So if you're calling on him to go because of that situation, I think he should go.
Should go before.
Yeah,
Dr. Gomez.
it's flabbergasting. It's unacceptable. I mean, nobody sues. I mean, you're not hearing anybody suing
that's
anybody
right, yeah.
here, suing anybody. You know, I mean, and just to follow up on Dr. Norton's point, you have been having investigation. Where's the report of these investigations? Okay, you identify a problem. We have a problem here. We're all Guyanese. This is the problem. How are we going to go about this? Muster our effort now to see how we fix it and the way forward. Well, you're not getting that at all. It's just this hiding up and covering up. At this point in time, you can't afford that. And so I'm wondering, with all this training, the training persons in alarm, you recall that was one of my questions in notice paper
Yes.
in the member in Parliament
Parliament,
there,
that's right.
and I
That's
got a
right.
good some letters, some answers there. but we want to put the theory now with the practice.
That's right.
I'm wondering if they're not having a good monitoring system. Who is supervisors? Have a problem with supervisory role of these staff or what? But something has to be done and done now. We have to do something now. We cannot have how many more deaths, as Dr. Norton says, before something happens.
You mentioned before about the because, okay, we are always told by Minister of Health, Dr. Barry Ramsarang, and the Ministry, and of course through the government's propaganda, state media rather, that we have the best health institution, we have the best facilities. In the National Assembly during his budget presentation, the Minister of Health, Dr. Barry Ramsarang, was ranting about Georgetown Public Hospital being the best and all of these doctors that have returned and so forth. The Parliament has continuously allocated funds to the Ministry of Health. There's no claim about cuts being made to the Ministry of Health, so the funding is there. Ghana is supposed to be striving to achieve its Millennium Development Goal. Where are we as it relates to that?
You know, the member of parliament, or now parliamentary secretary to health, who used to campaign with me on the for PNCR, you know, the Honorable Hamilton, you know, are talking about the House of Israel fellow.
Yes, sir.
Right.
Yes, sir.
He's now parliamentary secretary to the Ministry of Health, and he complained that all I do in the Georgetown Hospital is cry.
That's right. I recall.
And I did say I cry because I hear the plea of the children and the mothers out there, of the fathers who are expecting their newborn child to go home, of the mother who's expecting her grandchild to go home.
Exactly.
I hear that, and I hear that loud and clear, and we're worried about it, and things must be done to change that situation. How long are we going to wait? How long are we going to hear that, oh, we're training more nurses? I quite agree with Dr. Cummins. It's sustained monitoring and supervision that is necessary. You need them there. We don't have enough. We don't have enough nurses.
I want to bring it
And then the remuneration package.
That's what I just wanted
the
to
remuneration
I wanted
package
to
for
bring
these
that
nurses.
into.
I mean, it's next.
That's right.
You know,
The
wanna
salary is
keep them.
attracting and
Yeah,
keeping anybody.
That's
But
right, it's
it's
not.
it goes beyond that. We need to treat the nurses different. We need nurses to get certain benefits
That's right.
that will make them want to remain on the work. That will make them able to build a house for themselves.
That's right.
Last year there was a death at the Georgetown Hospital of a nurse. She worked the night before and died the next day, you know, and she worked for years at the Georgetown Hospital in the operating theater. What legacy has she left? What has she worked for all her life? She never bought a car for herself. She could never have done that. She never had a house for herself because she couldn't afford it. And, you know, she died literally a poor person. We're hearing that person got super rich because they saved their salaries. You know, that's what we're hearing. That's the explanation for some person becoming so rich in this country because they saved their salaries. What salaries are the nurses getting in order to save?
That's right.
You know, when one takes into consideration the cost of the food allowance hasn't been raised for decades, the clothing allowance can't buy even a proper shoe, and that the salaries can't mind them, and you know, the transportation system. We've got to start making conditions like giving them duty-free concessions for in areas that can make their lives more comfortable. You know, we've got to start creating housing schemes where the nurses can get loans from the bank and so on. Now the cost of the land is so expensive that nurses really can't build a house, and they will work for 20 and 30 years. And you know, this is a sector of the population that we've got to treat special.
That's right.
And until we start doing that, then we will continue to get the kind of situation. The nurses, just before I finish, the nurses hope to increase the pittance that they're getting by longing for overtime. What kind of job? Listen,
And they're taxing overtime.
Of course. But not only that. You had a life of somebody in your hands, the life of a baby in your hands, and you're gonna put somebody who's worked for more than 8 hours there to look after her. Okay? And I'm in sympathy with the nurses because they're good. I mean, they're our people, and meaning our Guyanese people here, who grew up with us next door to us, and our neighbors, they are our mothers, they are our sisters, they are our nieces, so they're part of us.
That's right.
And we're not giving them the job satisfaction that they deserve. We're not giving them the social security that they deserve. We're not giving them the incentives. And you better believe that should any of these investigations ever fall on the point on the shoulders of a nurse, they will not be spared. They will not be spared. So this whole idea that the minister was talking about patient satisfaction is a phantom feature in the Georgetown Hospital. I mean, that's what he's, as I describe him as being in the Gangnam Style.
Yeah.
He's there with his language and so on. That is a phantom phenomenon in the Georgetown Hospital, because he need more side rooms so that the patients can talk to the doctors and the nurses and so on. That's nonsense. What you need is more bed, you need more space, you need more fetal monitor, and you need more theaters for operation, so that we can avoid this situation.
Dr. Cummins.
But Chris, I'm worried about the patient to patient to staff ratio. I mean, for something with 3 or 4, I mean, that's unacceptable. We have a 5-level tier of health system here, and so we have the region, which is like a decentralized. So you have the health center. So you see patients, like mothers come to the antenatal clinic and so forth, you see them there. And I think what should happen is that we should have like these maternal health, not homes, but like institutions, whereby even before you go to the hospital, you can have within each region, like region 5. So
Yes.
from your health, okay, you can handle it at the health center, but then you go to this level.
Right.
And then, well, if definitely they can handle it, then you'll
You
go
go
to the
on.
next level. So you have like some kind, so everybody's going there, so it's overwhelming the system, and then you don't have the staff to take it out.
I know last week, Minister of Health, Dr. Barry Ramsrang, apparently he has just like Rip Van Winkle, he's just woken up and to the reality that persons go to the emergency unit of the Georgetown Public Hospital and would spend about 6 to 7 to 8 hours just to see a doctor. He's spoken about patients in the wards that they're there and no doctor seeing them until they're discharged and so forth. I mean, Dr. Barry Ramsrang have just learned this. He's learned what you would say the Victoria's Secret that every guy needs to know. That if you go to the Georgetown Hospital, you will spend hours at the emergency unit just to see a doctor. Because in fact, just a few nights ago, myself and Annette Ferguson paid a visit to the hospital, and we took photograph of these persons who were there for about 4 hours waiting, and they haven't seen a doctor yet. Now, this is a situation at the premier institution, the Georgetown Public Hospital. What is happening in the regions? Best Hospital or these regional units, because if the Georgetown Public Hospital, which is supposed to be the premier institution, is at this level of operation, of which persons, mothers, babies, newborn babies are dying, what is the situation at the regional hospitals and even for the health centers?
I think in some cases the health centers are doing, with the nurses and the doctors, they're doing a pretty good job. But I think when they would have done the referral, the follow-up,
That's
and
right.
in fact you would have referred the patient, you don't even get a feedback.
Okay.
So they have to improve the referral system. In addition to when you go to Georgetown Hospital, give us a feedback and ensure that you have more. With so many doctors trained, 200 and something coming
right.
back.
Yeah, that's right. That's right.
I mean, I
We-
can't
we-
understand.
I mean, Minister of Health spoke about the JAGDOs 500, sometime about 500 young
So
doctors.
where are they? Where are
Exactly.
they? And what are they doing?
Because I mean, as you mentioned before, about the remuneration package, the wages and salaries, is that these young doctors just wait for after 3 years contract agreement has ended and they depart. They leave to greener pasture. I want to now bring in this whole question about what we've seen recently in the newspapers. Oh, in fact, before that, we spoke about salaries for the nurses and so forth. And of course, it's even widespread. Coming out of the health sector, it's widespread. And Guyanese are frustrated. Those who are receiving meager salaries and those who don't even have a job at all. We've seen a report coming out of suicide in Guyana. That the suicide rate is spiraling out of control, if you want to put it that way. Dr. Norton, I note you were emphasizing about that report recently. Give us some pronouncement. Why so many Guyanese in this land of which every Guyanese we see in progress and every Guyanese are happy and living comfortable? Why are we seeing so many suicide? Why is the suicide rate so high?
No, this is not what Dr. Norton is saying. This is what the studies, whether it's a PAH or WHO study or whether it's from some other institution and university study, it points out that the main cause of suicide rate, which is in Guyana is the highest in the Caribbean and in the Americas, is hopelessness. Hopelessness, okay? Depression. And one has got to take that seriously into consideration, because the majority of the victims of suicide are the men folks, and they're in their prime years of production. Much more on the younger half of that. They're killing themselves because men folks in Guyana have what is referred to as you refer to it as the fulfilling role. They are the breadwinners. They're the head of the home. So what has happened? These youths are growing up in a society that they become hopeless. Then they can't see themselves achieving that role that they expected to achieve.
That's right. That's
Okay?
right.
And even if they get into, let's say, a job, they can't maintain the job. In the first place, there's no job. Okay? So it's the depressed economic condition that contributes in a large extent to the rate of suicide in this country. So it boils down back to the government of the day.
That's right.
You've got to be able to put certain things in place before we can start curbing the rate of suicide in this country. Because what happens? They express this frustration, this hopelessness in an aggressive manner. And then it becomes aggravated with substance abuse, particularly alcohol.
That's right. That's right.
Alcohol is not the beginning of it. It is aggravated by alcohol. And so what you have? You more the suicide. Because you kill first and then because you're not playing your role. But this is a serious situation. This is an urgent call to action. And while I agree with the minister that it's not only a health issue, one look towards him and must find out from him what are the efforts he has made to get a collaborative, a comprehensive effort to curb this situation. Okay, I agree. Everybody's got to come on board. All the NGOs, the churches, and we, from APNU's point of view, we encourage them, and we tell them to come on board, and we admire what they're doing. It's good. The anti-suicide march this morning, excellent. Okay, but we need the guidance from the ministry that is responsible for it.
That's right.
We need more trained psychiatrists. Dr. Myra Harris, but 3 decades alone here in this country, the only Guyanese psychiatrist we might have. How long I've been saying, I've been 40, 15 years in Parliament. When I'm representing health, I've been asking for trained personnel, get the people, the specialists involved. Okay, look at the psychiatric hospital that we have. Okay, train the counselors. We need that because people can't cope with the situation. And the majority of the victims of suicide had never seen a counselor before.
Yeah, that's true. That's true. Dr. Cummins?
Chris, we have spoken extensively, Dr. Norton and myself, even the leader, opposition leader, Mr. Granger, on this issue. And I want to be solution oriented. As medical doctors, we talk about the underlying cause, the etiology, underlying cause of this whole thing. It's hopelessness, joblessness. So what can be done? What's the way forward? The percentage, the age range is like 15 to 24, 15, 15 to 30, even to 34. I mean, in Guyana, so many resources we have, Chris. I mean, I'm comparing like Barbados, we just maybe have tourism or something to have a banana industry. So we have so many resources here. And I mean, I can understand why we can't have a canning industry here, why we close down the national service. Looking for a way out for these young people.
That's right.
So we have to get out and get to say, okay, this is happening. How are we going to address it? Together, multi-sectoral, bring everybody on board, as Dr. rightly says, and see the way forward.
That's right.
But in the immediate, I think we should get back our national service, get these boys, get a job, get a skill, and of course they're going to earn. And of course we're going to export our stuff, our corn or peas or whatever. But nobody seems to be. I don't know. Like it doesn't concern people. Nobody. It doesn't concern you, or you already set status set.
That's
So it doesn't matter whoever comes under you or whoever. What's happening. What's happening.
It's terrible. All right, viewers, this is indeed Nation Watch today, and of course in studio with me are my two guests, Dr. Karen Cummins and Dr. George Norton, both members of Parliament representing the Partnership for National Unity. And of course the topic we're covering today is the health sector. The number is up on the screen, and of course within a short time we will open the phone lines and permit you an opportunity to pose question as it relates to the topic we have covered here thus far. But before we go to the phone lines quickly, Dr. Norton, Dr. Cummins, you know that old people have a saying, you don't hang your hat where your hands can't reach. We spoke at length about the Georgetown Public Hospital and the lack thereof providing health to the Guyanese people. We spoke about wards without beds. We spoke about mothers who just deliver babies and have to share a bed with another mother with another baby. We spoke about Georgetown Public Hospital not having drugs to provide to patients, that patients have to go outside and purchase at the drugstore. We spoke about patients having to wait in the emergency unit for 6 or 7 to 8 hours before seeing a doctor. One would believe that you improve on what you have, and when that is better, then you move on. We see in this government, particularly Minister Dr. Barry Ramsrand, he has been the lead. He has taken the lead as relates to this. It is this specialty hospital. We note that the Partnership for National Unity and the opposition in Parliament made several cuts as relates to monies being requested for this facility, because we mentioned in the beginning that the contractual arrangement that have been signed is flawed and there are some issues. I saw, indeed, the opposition has been vindicated in its stance as it relates to the specialty hospital. Calls are being made for Minister of Health Dr. Barry Ramsrand to resign. I mean, by now it should have been a very long time ago. Would have a specialty hospital in Guyana alleviate all of the problems that we've spoken about in the Georgetown Public Hospital? The propaganda is this: a specialty hospital will take care of all of the beds and all of the medical facilities that you want and so forth. It is given the impression that the specialty hospital, the average Guyanese can just simply walk in and get treatment. Is this the case?
No.
What is a specialty hospital?
The whole question about the specialty has been one big secret.
Yeah.
Okay, a secret.
Another Victoria's Secret.
Yeah, another Victoria's Secret, and it is not that questions have not been asked. You know what was the answer? All the information is online. You know which part of our society we go online to get news. Why why the secret? Why didn't you put it in the newspaper? Let us hear that the Indian government has given us $8.5 million US for a specialty hospital and the conditions. It's only when you start questioning, are Guyanese going to be provided work there? Or could the Guyanese doctors work there? Are Guyanese doctors are going to be trained and become specialists there? You know, when persons start asking these questions, the response was not nice at all. As a matter of fact, I remember the goodly mayor was asking these questions in the newspaper, and he was deemed a racist. You know,
Yes.
because he was asking,
Yes.
who going to man the hospital? Okay, where are these specialists going to come from? Okay, and it's only then we heard that yes, Guyanese doctors would be trained, and probably you would have Guyanese working there. But I'm telling you this, at that time of the question, it would have been, we couldn't imagine that there would have been a project in Guyana where Guyanese could not have worked. But the Marriott Hotel was a practical example of what can really take place. So those were pertinent questions.
That's right.
Those were pertinent questions. Now, when you analyze this whole specialty hospital, the conclusion you come to is that this is going to provide a market for non-Guyanese healthcare providers.
That's right.
To sell their ware. And we don't even know if Guyanese would be able to buy it.
That's the question.
You know, they're going to sell their ware to who can buy it.
That's right.
You understand?
That's right.
Here and it's going to be built by the Guyanese, by the Guyanese government. Okay? And subsidized. Now, having said that we still don't know under these conditions under which we come to another big situation. In less than 3 years, this government had to terminate the contract of 2 big company.
That's
I
right.
mean, big projects.
After they were told by the opposition not to proceed. I just need to say
Exactly,
that.
exactly.
Yeah.
And not only that, for obvious questions. The first one, the hydro
project,
road. We ask, where is Phipps Motilal's experience in
Yes.
building any road? And we were told, oh, in Florida. And Florida has no records of him buying not even a driveway according to the newspaper.
Mercy.
You know? And they defended him. They still defended him like the old people say, cat on his back.
Mhm.
Okay? The same when they awarded the contract to Solyndra, the same question we ask. Where is Solindra's experience in building specialty hospital? Especially since bidders that was their forte.
Mhm.
You had the Federal Lloyds, who only used to build specialty hospitals in all over this world. Yet, and they were the lowest bidder. Yet they didn't get the contract. They give it to Surrender, and that's why it's good for the public to listen, to hear that. That's why we voted against the specialty hospital,
That's right.
because we were not getting the message that everything was transparent and accountable. Okay, and we voted against it because we were not convinced that this was above board.
Very well.
But they gave it to Surrender, a company that we never built a specialty hospital.
Mercy.
Okay, and what has happened? The government now has to come and take back the contract, a la Phip Motilal, from Surrender, because we understand in the case of Phip Motilal, he had no bank guarantee. In this case, we hear it's a forged bank guarantee.
Yeah.
But after the director ran, owing Guyanese $400 million and things like that. I mean, why is it that this government seems to have a natural tendency to be linking with corrupt companies and projects?
I think in that like my grandmother would have said, birds of a feather flock together. So, but quickly,
Well,
Dr. Cummins, and then we
Well,
go to
I
the phone
think you
lines.
estimate the worth of a man's work by his motive. So maybe they have other ulterior motives which we don't know about.
That's right.
They seem not. I mean, if you can't manage this health, the tier of the healthcare sector, the health posts, the health centers, the district hospitals, the regional hospitals, and our tertiary institution there, level 5 hospital. How could you? I mean, you can't handle this and master this and get this under control. How could you go to get a specialty hospital?
That's right.
I mean, they can't differentiate the vital from the expedient. Information gathering, I was told there is a specialty hospital in the Cayman Islands. And if you're looking at tourists coming, they're having problems. And Cayman Islands, so there's about 15 minutes or 45 minutes away from the US. Much more us. I mean, who will be going there? Is it persons, okay, you can't go to Trinidad, so you'll stay here and so the ratio of the beds, and does it worth a while? So nobody has done a feasibility study has been done on this thing? I doubt it.
Terrible. Okay. Well, I mean, once again, the opposition has been vindicated. Once again. All right, we go to the phone lines. Good day, caller.
Hi, good day.
Good day.
Actually, I was listening to the program, but I have a little concern. At the Lenora Cottage Hospital, we're being told through the media that so much billions and millions will be spent regarding drug purchase. Now, when you go there, they're giving you a prescription to go at the pharmacy to buy and return for a day to administer. So I don't know if Mr. Norton or Ms. Cummins can able to, forward it to whoever. When you call and report it to the PS and so on, all that they're saying, please call the, I think it's the regional health service and ask to talk to some manager or something.
Mercy.
Nobody listening to you. Nobody whatsoever. And all that they're telling you billions given to GPC, new GPC, sole provider, sole sources. And you can't be supplied with basic.
Medication.
Anyhow, thanks.
Thanks for coming, you call. All right, we're gonna take a few more calls and then we're gonna do the answering segment. All right, we go back to the phone lines. Good day, caller. Good day. Just speak up for us, please.
I want to get on to somebody after the program. How can I contact?
All right, sure. Immediately after the program ends, you call us back on the same number.
All right.
Thanks, Ladira. All right, the phone lines are still open. We have the first question being posed as relates to the Leonora Cottage Hospital.
Let me say something about that.
All right, sorry.
Go.
Okay, go ahead, caller.
Good morning to
Good day.
What I would like to ask, why are the nurses failing the exam? I believe that is the reason why we're having so much maternal deaths, because they do not know to handle a situation that is being done in the hospital. If a doctor is not there, nobody is there to supervise to make things correctly. We have to see where the faults are, why the nurses are failing the exams. Thank you.
Thanks a lot for coming, Siobhan. All right, Dr. Narn, you want to come in on the first?
Yeah.
Okay, go ahead, please.
What is to take note of is that of yesterday, the Ministry of Health did not know who won the tender to supply drugs and medical material, let's say medicines and medical medications. They did not know. Since the 14th of, I think the 25th of July, we heard that it was new GPC. The rule is that after this tender was open and so on, they should have informed all who made bids. They haven't done that as yet. Okay, the PS for Ministry of Health is saying that they don't know who is supplying them, and we're in September. We're in September of this year. So, what is happening? The Parliament sat and approved of this money for the longest while.
That's right.
And he's saying that he still doesn't know, or he wasn't informed officially. So it tells us how inefficient, how disorganized this whole government is, because we can't blame the Ministry of Health alone, because that tender process is affecting everybody else.
That's right.
You know, regardless of the amount that persons bid, they're not being informed of why they didn't get it in the first place, or what was the reason for not getting it.
We in fact, we call the government's operation on a what do's to come, what comes to do basis. That's how they operate. But I'll go back and I know Dr. Cummings wants to answer the question about the exams. Good afternoon, caller.
Good afternoon to you.
Good afternoon.
Hey, partner. I'm evidence to the fact that you go to Georgetown Public Hospital and you cannot get medication. I went to the psych department for because I have a patient goes there to repeat medication, and not even simple vitamins, vitamin C, multivitamin you cannot get at the psych department. The other medications you can't get none, and when you go to the drugstore for the other medication, it's $100 for one tablet, right? So this medication is for a month supply, right? It will cost me a good set of money to get it, which I do not have. And the other thing is that we every year we vote in so much money towards the health ministry, and I cannot understand what are they doing with this money. I think fraud is taking place, and we need to lock people up, put people behind bars for these monies. Thank you.
That's how it comes from. All right, I'll take another call, and then Dr. Cummings, you come in with the answers. Good afternoon.
Hello, good afternoon.
Good afternoon, sir.
Brother and sisters, now I wish to ask a question, sir.
Go ahead, please.
Now, do we strongly believe that everything or anything could happen without God intervention? Sir? Hello?
Yes, I'm listening. You're listening.
No, I certainly believe not. No, the God words would never fail, because say word will never return void. No, if we could come together to solve a solution to an important situation, we don't believe we should stop talking about this body and that body. This is a time where we have an emergency outbreak of diseases we're going to plague our future for tomorrow. We're talking about our children for the future for tomorrow. And I believe it's time you all come together, get you all act together, and come and try to solve this particular issue. This particular issue with this outbreak of all this. now, Laura, invite the Honorable Doctor and some other members of the opposition to come at this Cranbrook school and see what is going on with all these 100 and how much children. And you know what? Probably because somebody making somebody a fool.
All right, let me, before caller, hello?
Yeah.
Yeah, let me just inform you that this very afternoon, what time is it, 5? I think it's at 5 o'clock this afternoon at that very Cranbrook school. There will be a public meeting there, a community meeting rather, and of course opposition leader David Granger and several other members, including Dr. Cummins, will be at that meeting this afternoon.
You know, this what time you say?
5 o'clock this afternoon, sir.
All right. Just listen before I come off there.
Okay.
You know, I believe men, the male men, need to know their purpose in life, and the female woman, as God put it in the book of Corinthians, must know the place. How long we going to disrespect each other, spouse and husband and relative and good colleagues and friends and brothers and sisters? We got chaos in this country. Thank you very much.
All right, Dr. Cummins, Dr. Norton, but the question on the nurses and the exams, and we're going to take it as we
I just
wrap.
want to let a caller know that we are not attacking anybody.
That's right.
Ad hominem, we are attacking the issue.
That's right.
And we are all working together. Our name alone is a partnership. The name alone spells a partnership in unity. And so we want to see a good life for everyone. We want to improve the health of this nation so that we can be able to have a better workforce and less costs to a burden to the country. And so that's our reason for being here. Coming back to this, the drugs, and so I think right now the matter is in court. I think some distributor of this sole distributor, and I think other comes because there's no procurement commission.
That's
we
right.
need to have a procurement commission to monitor these drugs and so forth. Let's hope that it comes on board very soon. To answer the question with the failing of the nurses exam, there's a shortage of qualified nurse tutors. That has been identified as a major constraint to the expansion and strengthening of the nurse training capacity, and as is evident in the pass rate the last time. There's also a large student-tutor ratio, there's overcrowding, there's insufficient training materials, and inadequate infrastructure. These were all positive for this dilemma. So it's a multiplicity of things, and we hope that it will be addressed soon.
Very well. Dr. Norton, in wrapping up.
Just to let the last caller know that while I'm APNU might not be, let's say, blessed with having men of the cloth amongst their membership member of parliament.
I think Pastor Rensmore, you're meeting.
Oh, sorry.
Yes.
But I would just hope that the Reverend Kwame Gilbert's prayer would be heard, as well as the bishop, and they would, and the good Lord would help them to get their act together and help Guyana to move forward. It is a fact that we are here for a specific role.
Yes.
We are here to support the development of Guyana.
That's right.
Okay? We are here to point out where the government is not being forward with accountability, with transparency. We are here to advise and, of course, to support whatever efforts are being made to give the Guyanese the good life. The APNU will never stand in the way of a developmental project where all Guyanese will benefit, regardless of where that project is from. I mean, which country is supporting the project, is financing the project, and regardless of where it will be situated. We are here for the development of all, and if we, as it's claimed to be, seem not to be supporting certain projects, is because we have doubts about it.
Very well.
And we don't want to be a guilty bystander of allowing corrupt transactions to take place at the expenses of
the Guyanese people. Excellent. All right, and that will be the final word. We'll have to leave it here. And of course, again, the opposition once again has been vindicated in its position and its stance for cutting allocations to various items being requested by government. This has been your Sunday edition of Nation Watch Today. My name is Christopher Jones, and on behalf of my two guests, Dr. Karen Cummins and Dr. George Norton, both APNU members of Parliament, we would want to quickly reiterate to you that on Friday, that is this Friday coming, The Youths for David Granger will be hosting its third public meeting at Lusignan Market Tarmac. The meeting commences at 5:30 sharp, and of course you saw amongst the list of speakers include yours truly, Ms. Ramrati Jagdeo, Mr. Ronald Bulkan, Dr. George Norton, and of course others. So all of the persons out there around Lusignan, you're invited out to the public meeting this Friday at 5:30 p.m. This afternoon, residents in Anns Grove area, you are invited to a community meeting at the Clanbrook School, and of course, Majority Leader David Granger, Dr. Karen Cummins, among other members of the AP, and you will be present. In Georgetown, the walkabout continues. The Georgetown District Chairman, Ms. Valda Lawrence, will be continuing her walkabout exercise, and this afternoon they will be again in the Meadowbrook Gardens, Tugville Terrace, Guyhawk Park, Lamaha Park, amongst other communities with the walkabout. So please look out for those. Until next Sunday, my name is Christopher Jones. Thanking you for joining us on today's program. Until next time, goodbye for now.
Granger will succeed. 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 Granger will succeed.